epidemiologists make a beeline for the scene of the crime when a disease first strikes, to search for clues that reveal how the outbreak started, how it is transmitted, what puts people at risk of getting sick, and how to stop or slow its spread. Just like the hard-boiled detectives in old movies, they talk to the victims, track down witnesses, ask lots of questions, sniff out facts that may have been overlooked, and then assemble their case. In addition to these tried-and-true detective techniques, they also take advantage of the latest technologies and use their scientific skills and know-how to understand how diseases spread and to protect our health. The investigation into an outbreak starts with the first patient who shows up at their doctor's office or local hospital with an illness. While epidemiologists call this first patient the index case, in the media and popular culture, this person is often referred to as Patient Zero. Spoiler alert, to find out how Patient Zero became a popular term for the first known case in an outbreak, flip to Chapter 7. Starting from this first case, epidemiologists trace the infection spread. They look for clues that help them understand the factors that contribute to the transmission of the disease. Tools of the trade. Think like a microbe. Epidemiologists are up against tiny but powerful enemies, the microbes that make us sick. Although they are microscopic, they vastly outnumber us. There are as many species of microbes as there are stars in the galaxy. Fighting this invisible army depends on understanding it. To start with, not all microbes are bad guys. Microbes live all around us and in us. Some make us sick, but many others, like the ones that live in our guts and help us digest our food, are important for our health. Viruses are incredibly tiny microbes that can only survive inside the cells of other living things. A virus invades a host cell and takes it over, using the cell's energy to multiply itself and then releasing new viral particles that go on to infect more cells. Most viruses cause diseases in the host organism and have evolved ways of spreading to new hosts through the disease. For example, influenza viruses make us cough and sneeze. Each time we do, we spread viruses in clouds of droplets, giving them a chance to find new homes in other humans. The cholera virus gives its unlucky hosts diarrhea, and the virus spreads to others when their waste finds its way into drinking water supplies. Sometimes, as with malaria and yellow fever, a virus will be in the host's bloodstream, and when a mosquito takes a bite of blood from one host and then bites another, the virus comes along for the ride, and now two people are infected. For an epidemiologist, knowing how a microbe spreads is key to understanding and stopping an outbreak of disease. This means tracking down, one by one, everyone the infected person came into contact with. It takes patience and determination. And it also doesn't hurt to have charm and a sense of humor when you're asking people to try to remember everyone they might have coughed on recently. Lots of the detective work of epidemiology happens at a local level, by knocking on doors and talking to people who may have been exposed to the disease. But epidemiologists also need to coordinate their disease-fighting efforts with other scientists, and with governments and public health agencies nationally and internationally. Today, a disease outbreak can spread around the world in just days or even hours. To be prepared for that kind of global threat, modern epidemiology requires teamwork, cooperation, and endless tracking of information about health concerns from all nations. At public health agencies like the World Health Organization, WHO, the Center for Disease Control and Prevention, CDC, in the United States, and the Public Health Agency of Canada, PHAC, epidemiologists are constantly scanning new reports from all around the world of unusual diseases or new outbreaks of known diseases. They know that any one of them could be the next big one. In December 2019, doctors in Wuhan, China, started seeing an increase in the numbers of patients with pneumonia. When they realized they might have an outbreak of a new disease on their hands, they notified the WHO, an agency of the United Nations that looks after international public health. Those pneumonia patients were the earliest victims of a virus that had jumped from an animal host to humans, triggering an epidemic that led to a global pandemic, COVID-19. The big one had arrived.